Come on, skinny love, just last the year. Poor little soul, we were never here. My, 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 my. Staring at the sink of blood and crushed veneer. Told my love to wreck it all. Cut out all the...
How many people in the United States have eating disorders?
I think like a couple million.
I would say about 25%.
I think probably around a couple million.
I would guess maybe 6 million.
How many people in the United States have eating disorders?
Too many.
8 million people in the United States have eating disorders. Of these 8 million, 7 million are female and 1 million are male. What causes eating disorders?
I would think it would be insecurities or the perception to live up to models in magazines.
I think that self-confidence has a really big role in that. I think it's partly the pressure of the stereotypical person in the United States. Like the average or like the ideal person is like really skinny and all the models on Victoria's Secret or like on the magazine covers like 17 and Allure are all really skinny, so like people want to be like that, so they like try to do whatever they can to look like the perfect ideal woman.
The conditions that we see eating disorders stem from can be psychological, behavioral, interpersonal, social, and biological. Many people who suffer from an eating disorder say that they feel a lack of control in some area in their life, and to feel some sort of control, they dictate how much and when they eat.
I only know about 2, bulimia and anorexia.
I honestly couldn't name one.
An eating disorder that I can think of is anorexia, and that is where a person starves himself or skips meals to make themselves look thinner.
Another one I know of is bulimia, which is where you eat, but then you go in the bathroom and like throw it all up. So you still like eat and justify it, but then you throw it all up. So
Another type of eating disorder is called binge eating. This is where an individual will eat a large amount at one time and then refuse to eat at any other points in the day, or will continue to eat all the time, all day, and that can lead to obesity.
Anorexia is characterized by self-starvation, weight loss between 15 to 60% of the normal body weight, and an intense fear of weight gain. Bulimia is characterized by binging and purging at least twice a week for 3 months or longer. The person affected usually has a normal to high normal body weight, but the weight fluctuates by up to 10 pounds. Binge eating disorder is characterized by binge eating without compensating for calories. This type of eating leads to possible significant weight gain. Many times the individual eats between 5,000 and 15,000 calories in one sitting and continuously overeats throughout the day. An additional eating disorder is called eating disorders not otherwise specified, also known as EDNOS. Some examples of EDNOS would be binging and purging infrequently, displaying anorexic behaviors while maintaining a normal body weight, or repeatedly chewing and spitting out food before swallowing. What would you do if you thought a friend had an eating disorder?
I'd probably I'd want to talk about this issue with them and let them know that they have someone to talk to whenever they need to. And I'd probably try to encourage them to talk to an adult about this or go visit a pal.
I would say you have a responsibility to go to a counselor or somebody. Keep it confidential, but you should tell somebody about it, at least to talk about your role in supporting your friend. Not necessarily ratting your friend out, but you do need to talk to somebody about it.
I think I'd probably talk to them about it and maybe seek a counselor if needed.
I think that my first step would be to talk to that friend and figure out why it is they feel like they need to, change their eating habits, because in order to solve a problem, the first step is to figure out what that problem is.
I think that it's really important if somebody shows signs of an eating disorder, for myself to talk to them at first and just make sure that they are okay. If not, we have a lot of resources here at Matawan High School to help these people. That's with the PALS program, with Mrs. Fleshier, and with our counselors. There's a large support system in which these people that are suffering can get help and continue to have help.
How much did you learn about eating disorders in PALS?
This unit is something we cover really extensively in PALS. We even had a few guest speakers come in and talk.
Yep, we had a pediatrician from one of the local doctor's office come in and discuss some of the issues she's seen and how they kind of deal with it.
We've also had a student who talked to us who's really been in that situation, and so the student could give us a lot of insight on what it's like to be there.
As a PAL, how do you help someone with an eating disorder?
I think the most important thing we can do is provide a comfortable place for them and support them, and then kind of refer them to Mrs. Fleshier when it gets to a point where there's not much more we can do, but she can take the reins and move forward with it.
Many medical problems arise from these illnesses. Repeated vomiting from bulimia can lead to dental issues, esophagus damage, and swallowing problems. Low potassium levels can lead to potential paralysis or dangerous heart rhythms. Anorexia can cause heart problems, hormonal changes, and organ failure. Binge eating disorder has the same complications as obesity, such as heart disease, type 2 diabetes, high blood pressure and cholesterol, some cancers, and sleeping problems. Recovery is possible and can include inpatient, residential, or postural hospitalization or outpatient care, depending on the severity of the case of the individual. Thankfully, the majority of people diagnosed with eating disorders are free from them within 10 years of treatment.